Statistics reveal that HIV prevalence in Mombasa County is reducing compared to the previous years, whereas the rates of viral suppression among children raises eyebrows. George Kissinger, the HIV-AIDS and TB coordinator in Changamwe sub-county, says statistics from National AIDS Control Council indicate that the prevalence rates in the county in 2013 was at 7.4 and 7.5 in 2015. And has reduced to 6.2 in 2019.
If you look over time from 2013 to current, we are saying at the moment we are at 6.2 in terms of prevalence from the previous high of around 10%. And this one is a success in terms of the various interventions that we put in place.
Speaking in Mombasa, during a Science Cafe hosted by Mesha, Kissinger mentioned a few measures the County Department of Health has put in place, including sensitization among the locals through community health volunteers and peer educators.
To HIV testing like family planning, screening for non-communicable diseases like diabetes and hypertension clinic. We've also had interventions targeting people who inject drugs, that is in terms of needle and syringe distribution to ensure that there is injection safety, coming up with issues of harm reduction again, having worked with the civil society organizations in terms of follow-up. We're doing condom promotion and distribution, and also improving in terms of nutrition counseling and also treatment of STIs.
However, he expressed concern on the rate of HIV viral suppression among children under the age of 15 years.
As of the 2020 estimates that come from the National AIDS Control Council, we've made quite a considerable progress compared to the previous years. Of all age groups, we are talking about 61,629, out of which 58,046 becomes adults in terms of the estimates, whereas children about less than 15 years comprises 3,223 in terms of the numbers. Adolescent 10 to 19 years will be 2,353, whereas adolescent and young people aged 15 to 24 will comprise 5,091.
At the same time, Chief of Party of USAID at Stawisha Pwani project supporting HIV and TB prevention in the coastal region, Dr. Patrick Oyaro, says for the government to attain 95 by 2030, it needs to introduce policies that can encourage HIV-AIDS prevention measures, including sensitization, self-testing, and the use of ARVs.
We expect organizations to have policies on HIV within the workplace. And the policies on HIV would tackle on things like even testing, issues of stigma and discrimination. Because a lot of people fear even going for HIV testing because of the stigma that we still have. So having a policy that touches on HIV testing or access to services, even allowing health workers to come to your workplace to be able to offer free testing, or call us to go and just have a discussion on HIV and have people answer questions. Because there's a lot of myths and misconceptions that we still even have right now. And the only way we can do away with those myths is having this conversation.
The experts also encourage that Kenyans should be sensitized on the use of PrEP and other modern methods of preventions. Belia, Saulo, reporting for Mesha.